Medical professionals overdid it. What is the craziest DIY treatment you've seen a patient attempt? Anesthesiologist here. We had a patient come in for IND of bilateral deltoid abscesses. He apparently had thoughts of being a bodybuilder, but instead of lifting weights or knowing someone who could hook him up with some quality steroids, he decided to bulk up by using some protein powder at GNC and mixing it with water, drawing it up into a syringe, and injecting 20-40 cc daily directly into the muscle. If bulk was what he was going for, it definitely worked, temporarily. A rip-roaring localized infection makes you look plenty swole. They got almost a liter of pus mixed with liquefied protein powder out of each deltoid. This also wasn't the first time he'd been in for this problem. My dad had an abscess on his face. It was huge, about the size of a golf ball and horribly red. It kept getting bigger. My mom, a nurse, kept telling him to go to the doctor, but my dad was a ridiculous cheap butt. One day when she was gone, we noticed that a big white head had formed on the abscess, and it was apparently ready to bust. My dad went out to the garage, got his shop vac, placed it over the white head, and proceeded to suck out the abscess. It worked surprisingly well and healed up after that nicely. Mum was still furious, though. Paramedic here. Once had to explain to a family that putting lemon juice in the eyes of an unconscious patient isn't an approved treatment method. And no, it didn't work. It was an interesting moment when I had to explain why his eyes hurt. Smelling salts equals seeing acids. If I've learned anything from reading the comments here, it's that some men will tolerate almost any amount of pain to avoid a doctor seeing whatever stupid crap they've done to themselves. This is no exception. I once spoke to a paramedic who went out to a man at 2 AM who had excruciating pain down below. The poor organ was wrapped tightly in soaking bandages, and underneath was a blackened penis with large pus-filled holes in it. The man eventually admitted that he shoved a chicken bone, a clean one, whatever that means, down his dong for pleasure. Predictably enough, he couldn't get it out, and being too embarrassed to go to the doctor, he left it until he was in so much pain he couldn't walk, both from the rotted penis and the fact he hadn't been able to urinate for days. Apparently you could actually see the bone once the wound was clean, and although not an expert, my friend couldn't imagine that what was left was salvageable. I had a guy come in for coughing and shortness of breath for the past few months. His lungs sounded like absolute crap. Got a chest x-ray that looked horrible, so I did a CT scan. Radiologist called it the worst case of necrotizing pneumonia he'd ever seen. Dude had like a 15% functional lung tissue left. The patient then mentioned things had been worse after he started using a new breath freshener spray. He whipped out one of those Blunt Effects concentrated air freshener bottles, supposed to cover up weed smell, labeled not for internal use. Apparently he had been using it like Binaca spray, and had already gone through 3 bottles. In nursing school, while I was on clinical rotation in urology, there was a man who ended up having his penis removed. It turned out he had an infection brewing for quite a while and thought the best course of action was placing a sock over his penis in hope that it would heal. He was generally confused and upset as to why this didn't work to heal the issue. The classic, if I can't see it then it's not a problem. One of my first clinic patients was a dude who was injecting a mixture of testosterone, human growth hormone, sesame oil, and sunflower oil into the base of his penis as a DIY penile enlargement therapy. Well, it got infected, so he ended up going to the ED for incision and drainage. I saw him as a post-ED visit, and at that time, he figured that he shouldn't be injecting into his penis while it was healing. So instead, he was injecting his oil and sketchy hormones off the internet concoction everywhere else into his body, arms, legs, butt, shoulders, etc. because he figured it would still have some effect. Till, some men are capable of committing atrocious, heinous acts of terror on their own dongs. There's a myth that lowering someone's core temperature will save them from an opiate overdose. As a result, many first responders have arrived on scenes to find friends, fellow users inserting ice into someone's rectum. Sometimes they don't have ice around though, which leads to getting inventive. Popsicles, frozen hot dogs, my personal favorite, which regrettably I didn't witness myself, it was told to me by another medic, was a bag of frozen French fries. Cold will do nothing to help someone who is overdosing on H or other opiates. What they need is respiratory support, oxygen and or artificial ventilation, and naloxone, Narcan. If you're a user or know one, and somebody ODs, call 911, perform mouth to mouth and give Narcan if you have it, but leave the popsicles in the freezer. I work in dental and years ago had a patient attempt to superglue her front tooth back on after it broke in half. She screwed up and ended up gluing the chunk to her upper lip. I had a dental patient with a dead front tooth that had turned black, so she painted it with white nail polish daily. This happened when I was still a med student doing a rotation in the ED. Patient comes in and is pretty vague about his actual complaint. Something about head pain, but he looks just fine sitting waiting to be seen. When I finally get to see him and ask him what actually happened, he removes the hat he was wearing and a chunk of skin about the size of my hand literally flaps off of his skull. This guy managed to basically scalp himself, and apparently it had been like that for 3 days. According to him, it was caused by falling in his bathroom and hitting his head on the toilet. He had been previously duct taping it down or using the hat to hold the skin on, but it wasn't sticking well, and that's when his wife convinced him to come to the hospital. I like my skin on my body more than I dislike hospitals. Pharmacist here. Worked in a shop where a woman asked for some advice about potential UTI or STI. Told me she had bathed her vagina in bleach for 5 minutes to try and kill any bacteria. Miraculously, she hadn't done any lasting damage. A 50-year-old man swallowed a chicken bone while eating, and it got stuck down his throat, upper esophagus. Unable to take it out with his fingers or coughing, he got a fisher hook with a line and tried to rescue the bone with it. He ended in an emergency department with both the bone and the hook in his esophagus. An old lady told me the rain hurt her arthritis. That's reasonable. She also swore that dogs spit had healing properties, so she let her dogs lick her feet when she felt it coming on. She then wanted to show me a video of said dogs licking said feet. I swiftly and politely declined. Adult patient had gas and poked a hole in his belly button with basically a knitting needle to release it. I didn't think it was possible to ever cringe this hard. You've proved me wrong. I work in oncology pharmacy. I had a patient die of totally treatable breast cancer because they decided to treat it with mistletoe instead of chemo. All because Suzanne Summers did. Yeah, the Thighmaster lady. Don't take medical advice from the Thighmaster lady. A little late to this thread, but have a weird one. A patient was told by her doc that she had low magnesium and should consider supplements. It's not uncommon. Instead of getting MG supplements, she ate an entire tub of homeopathic volcanic ash and completely destroyed her electrolyte imbalance and ended up in ICU. We admitted her as a pharmaceutical overdose, so poison control automatically follows up with you. It was hard to explain to them. Ate an entire tub of homeopathic volcanic ash. Dang, that's some advanced stupid right there. A mentally delayed woman came in septic to the ED. Did X-rays, blood cultures, urine cultures, the works. Finally found this weird image on her pelvis film, and we had Jin come do a pelvic exam. They pulled out this blob with bones in it. Y'all, I swear to God, it was a decomposing frog. She put it in her vagina for safekeeping. She got toxic shock syndrome from a frog. Not me, but my boss, mother of the child I care for, is a nurse practitioner. I asked her what the worst thing she had witnessed was. She continued on to tell me the story of a man who had stapled his ball sack together and onto his body after slipping with the razor. He had it that way for days, metal holding his poor testicles in place, infected and gross as you would expect, before he came to a professional. Later admitted his ex attempted to castrate him. The balls lived. Later admitted his ex attempted to castrate him. I guess that's why you don't judge people when they come in with weird injuries. Dude came to the ED because his leg was swollen. I'm talking, like, twice the size of his other leg. It turned out that his 4th and 5th toes were getting caught on his sock, which, to be fair, sounds super annoying. So he cut them the frick off with scissors, and then it got infected, and he waited, and that's how he lost his entire fricking leg. Having once seen a commercial that oatmeal can lower cholesterol, a patient started having chest pains and tried to resolve it with a bowl of oatmeal. We had a guy come in with an abscess on his right thumb. When I asked him what happened to his hand, He told me about his recent deep sea fishing trip and was given the responsibility of cutting the fish with an open wound in his hand. A sliver of fish got in there and became infected as it healed. So this guy gets the bright idea of doing a little DIY wound drainage by grabbing his pocket knife and cutting it open, leading to a greater infection. Yep, I had a crack addict cut her thumb on her broken crack pipe. The thumb was incredibly infected. She grew tired waiting for the hand surgeon to arrive. He was in the operating room with another patient, so she bit her finger to release the pus. Then she left the hospital, cursing the staff the whole time because we are useless, etc. As a child I got really bad sunburn. The person looking after me coated my sunburn in baby oil to help it heal, and sent me back out into the sun. I realized when I was older why my mum went nuts. I have a Jamie Oliver recipe that directs me to do the same thing midway through roasting a chicken. My mom once melted Vicks Vapor Rub into my tea because she thought that would help my cold. It didn't. I know people who would do this. More than one of them. They'd swear by Vicks Vapor Rub and kind of treated it like a cure-all. Patient used to get boners in class and it embarrassed him, so he used rubber bands to prevent it. Ended up killing the tissue in his penis and now he needs a catheter for life. A man who'd accidentally sliced his leg open at his workplace. He obviously figured that as surgeons use staples to close wounds, he'd cut out the trip to hospital and DIY with an ordinary desk stapler. Arrived in ED with a pus-filled wound with the odd discolored staple hanging off it some days later. I am not a medical professional, but my father-in-law had severe skin cancer. He basically had an open sore on his back for several years that bled and bled. We never knew about it until one day we saw a pancake-sized crater through his shirt. Went to the hospital finally and they basically said he has cancer throughout his whole body at this point. His response was he thought it was a cut that wouldn't heal and put gauze and Neosporin on it. God, that's terrible. I've found that sort of attitude is common among older people though, where they sort of shrug and get on with it. When my granddad was young he fell and dislocated his shoulder. He decided to just pop it back in himself and forget about it. It's never properly healed and still causes him pain so many years later. White bread soaked in milk placed on an armpit abscess to draw out the infection. Needed an IND and a couple weeks of IV antibiotics by the time he got to us. Either that or the guy who crashed his motorbike, scraped his leg all to heck, and then decided the best course of action was to self-cauterize it on the tailpipe. Whoa, stupid or not, the tailpipe guy had a set of brass ones. When I worked in my colleague had to see a guy with an ear problem. He had something stuck in his ear and had been trying to get it out. This wasn't a new thing. He'd been trying for some time. Turned out, he had completely removed his tympanic membrane, and the bits that were stuck in his ear and that he was trying to pick out with cotton buds and hair clips were his ossicles. Enjoy. I have consistent skin irritation in my ears and try and limit myself to sticking cotton buds in my ears to 4 times a week for relief. Thank you. You've cured me of this vice. And I'm setting myself on fire. Good day. Had a patient come into the ER with a makeshift bandage on his shin. He had fallen on rocks while hiking and left a 3-inch long, 1/2-inch deep gash in his leg. I go to pull the bandage off and as I'm peeling it away I notice the skin is completely black and there's dark chunks of fungus falling out of the wound. It looked necrotic, like it had been left alone for a week. I look at this guy like he's crazy as he tells me the wound is only a few hours old. He's pretty proud as he explains that he created a makeshift poultice by chewing up leaves and moss, mixing it with river mud and stuffing it into his leg. That's what all the black mossy stuff was. Hint, don't do this. My grandpa thought a leg discrepancy was causing my back pain, which was causing spasms. He put several pieces of cardboard in my shoes to try to even out my legs, which were already even. He also thinks black beans cure everything. My dad thought those pesky spasms was a pinched nerve, so he would take me to the chiropractor, his girlfriend, to get my neck cracked when it happened. Seizures? People, they were seizures. Black beans are delicious and make a beautiful blue dye. That's useful enough for me. I'm hoping you get actual medical care now. My stepfather thought he had an boil of some sort on his arm a few years ago, so he did what any middle-aged dad would do, cut the sucker open and poured hydrogen peroxide on it. Turns out it wasn't a boil but a form of skin cancer. Also turns out that hydrogen peroxide doesn't do much to help with melanoma. After a lot of one-sided discourse he went to the doctor to get it checked and treated. He's now cancer free. I work in the ER at a trauma center. This guy comes in with his little girl and says that she was bit in the face by the family German Shepherd. I immediately take her back assuming that I need to control bleeding. What I encounter is a little girl with a laceration going all the way from over her left eye crossing her nose and mouth. It is not bleeding whatsoever and it seems to have an odd looking substance inside. So I obviously ask the dad what she got inside it. He responds very proudly with, "Ah yes. I packed the wound with tobacco from my cigarettes and super glue." Left double quotation mark. Poor thing. Tobacco certainly has antibacterial properties, but pure tobacco, not a cigarette mix. During third year med school I was on a neonatology rotation. Lots of premature babies or high risk births. We'd get code green page to us for please come to delivery room as able and code pink page for please come to delivery room stat. There was a pager that was the standard one that got paged for this, and usually it was whichever of us med students who was on call carrying it. Our job was then to get one of the nurse practitioners and possibly a second nurse and head over with the incubator etc. to take the baby and get her to the NICU. About 6 PM one evening as we're doing handover rounds, that pager goes off with a code pink. Then the NP's personal pager. Then the neonatologist's personal pager. The next 10 minutes are a bit of a scramble and not particularly interesting from the point of view I had, as I was assigned to send pages to additional people and fetch things. But in short, a teenage lady of local Aboriginal descent had come in suffering from very premature labor. I want to say 20 weeks, but could have been 22 or so. She and her ex-boyfriend had recently gotten back together. He had discovered she was pregnant. Believing that the baby was not his, he attempted to abort the baby by inserting a bamboo stick and trying to fish it out. She did not want said abortion so he attempted while she was asleep. Baby and mother survived. Relationship did not. Later testing showed the baby was indeed his for those wondering. Dental student here. We had a patient who declined a much needed cleaning saying he could do it just as well at home with a scalpel. Didn't brush his teeth but every few weeks he would go at the accumulated plaque and tartar with a scalpel. Same patient also insisted we do a procedure without local anesthetic. He was an amateur boxer and was building up his pain tolerance. He also told us he smoked 20 blunts a day and only drank coke. We could tell. You've been visited by swining thick boy. Like and comment swing well thick boy and you'll be blessed with many thick woofers in your life. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Or don't. Either way, have a great day you magnificent people.